Halo, Assalamualaikum warahmatullahi wabarakatuh. My name is Fadhil Putra Prabu, and today I will explain to you about stuttering. So, let's get started, and I'm going to explain it. So, stuttering is also called stammering or childhood onset fluencies, is a speech disorder that involves frequent and significant problems with normal fluencies and flow of speech. Like, for example, some people who got the problem of stuttering, they may repeat or prolong a word, a syllable, or a consonant or vowel sound. Or they may pause during speech because they reach a problematic word or a sound. So, for example, if there are some people who have a problem with stuttering, they keep repeating the word, or eventually they can't really speak the word properly. So, So stuttering is a common among young children as a normal part of learning to speak. Young children may stutter when their speech and language abilities aren't developed enough to keep up with what they want to say. So basically, some children like 4 years old or 5 years old, like they're in still developing the way how they speaking and the way how they processing a word. But sometimes some of the children on that age really don't have to like really can't to process the word like what their parents teaching to them, so that's why they get the problem of stuttering. And then some of researchers continue to study the underlying causes of and development stuttering. Combination of factors may be involved, like possible causes of development stuttering include abnormalities in speech motor control. So basically, in most of the children in their brain, they have the abnormalities in speech motor control. So that's why, in particular way, like the children age around 4 to 5 years have really a problem to speak a word that like they don't speak in the first time. Some evidence indicates that abnormalities in speech motor control, such as timing, sensory, and motor coordination, may be involved. Genetics also take part as the cause of stuttering because stuttering tends to run in families. So basically, there are two possibilities of someone that to get a problem of stuttering. So, for example, they have a problem with their brain, like like timing, sensory, and motor coordination, and there's some of them have the genetics from their family. So they basically there's like his father or the children fathers or the children mothers or from the grandmother or the grandfather who had this stuttering problem before. So they had the kind of same problem in their DNA, like when a children born and they brought it to that DNA, and then that DNA is just exactly like a copy paste from the previous generation, so that the the generation that come, maybe they get the problem as the same problem from the different generation. So the stuttering signs and symptoms may there's a lot of symptoms from the stuttering. For example, difficulty starting a word, phrase, or sentence. So they basically have a hard or difficulties to saying a word, or even they saying something a word that they actually want to say a word like they already know in their brain, but at some point they can't say a word like processing into their mouth that they can't really processing into that point like they can say it, and prolonging a word or sound within a word. And the third one, repetition of a sound, syllable, or a word. So just like I said before, like they always keep repeating the word like they want to use to say, they want to say. Brief silence for certain syllables or words, or pauses within a word. So there's some kind of type of stuttering that people really can't say. Like some people stuck in some particular letters, like a. For example, they want to say Aaron, but the processing in their brain already know that it's Aaron, but their mouth can't really say Aaron, so they stuck with the letters A, like A. But there are some people who really can't spoke it the word and just silence, and they're just pause immediately, like they're saying like A, but they can't really say it like the continuous of the letters or the continuous of the word, like Aaron, and they can't really say the Aaron because they just stop. They're pausing like in the A. They just stuck in the one letters. And there's other one, addition of extra words such as if the difficulty moving to the next word is anticipated. So there's basically some other people too who get the problem of stuttering, that can't really say the word, so they just thinking themselves and they saying or something like that. They can't really say the word, but it's the same, like the word is already in their brain. Excess tension, tightness, or movement of the face or upper body to produce a word. So they just like moving the head, they're trying to remembering that, trying so hard to spoke it with their mouth, but they really can't say it. So they're just using their body to expressing, like they're trying to spoke it with their mouth. Anxiety about talking. So there's basically some other people too, like they're afraid to talk to someone, and or they're really nervous to talking to someone, like they have that anxiety to speaking to someone. Limited ability to effectively communicate. So it's basically the same as the anxiety about talking. So it's the ability to communicate with someone. So sometimes people get really nervous when they're speaking to some other people. So that's why the ability to communicate is really hard for them, and then they got the problem of stuttering. So how do we get of this? I mean, like how to prevent to someone or even a child who get a stuttering. So there's a 3 treatment that we can get to you to finish the problem, like the stuttering. So there are several ways. So the first is when they're still in a children age, like 4 to 5 years old, some other parents can teach the words like really slowly, and then try their children to follow their parents to speaking. Like for example, if the parents were trying to teach, for example, a word shower, the parents can't just slowly speaking to their children like shower, like that. And then for the second treatment, that the speech therapy. So the speech therapy is aimed to reduce speech disorders and increase the patient's confidence, and so that the confidence of talking to someone is increasing. Speech therapy focuses on controlling the symptoms of stuttering while speaking. During speech therapy, the patient will be given instruction to minimize the appearance of stuttering by speaking more slowly, controlling breathing when speaking, and understanding when stuttering will occur. This therapy can also train patients to manage the anxiety that often arises when communicating. And there's also the third treatment, which is the involvement of other people. It is very influential in the process of controlling stuttering. Understanding how to communicate well with people with stuttering can help improve their condition. Something that can be done to communicate effectively with people with stuttering. So basically, stuttering is really a problem, but the stuttering, it's a problem that can be fixed from the young age. Even when some adult is already have the stuttering, it can be cured by some other people too. I mean, like the help from the other people. Okay, so thank you for listening to my explanation about stuttering. I'm very sorry if my pronunciation of a certain word, that not really correct. So that's it for me. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.